I'm Dr. Nishant Yagnick. I'm head of neurosurgery in Manipal Hospital Gurugram. And today I'll be talking to you about a topic that people generally don't have much information about, but actually affects many more people than one would might think, and that is tumors of the spine. Why tumors of the spine are so important is for two reasons. The first is that the majority of these tumors are benign, they're non cancerous, and they can be removed with a very good result, in so that many of them do not ever come back in their life. In the patient's life, we for this we use microscopic and endoscopic techniques for very small incisions to do the same. The second and more important reason to know about spinal tumors is because the majority of cancers in the body actually produce tumors in the spine when they spread. So often, back pain and neck pain, often thought of by patients as cervical or sciatic pain, and is often ignored by people because they think it's a disc problem. These are actually the first symptoms of what can be a cancer that is spreading. The reason the spine gets such a lot of value when it comes to spinal tumors or tumors elsewhere is because it goes all the way from the base of the skull all the way till the pelvis. It takes its blood supply from so many different vessels that it is one of the most common locations for cancers to spread. Many times I've had patients who've come to me with long term back pain that turned out to be tumors that ultimately turned out to be a cancer that is spread to the spine and not from the spine itself. So, I would say that about 60 to 70% of patients of spinal tumors, we can actually get the entire tumor out with techniques that are actually much safer than operating in other parts of the body because the spine allows us access so easily. It starts off very much under the skin and the muscles of the back, which makes it a very superficial organ to operate on or to biopsy, which also makes it easier for us to get a biopsy and to remove the entire tumor. So, in conclusion, number one, do not ignore pains in the neck or in the back or even in the spine of the chest. Just thinking that it might be a disc problem or a cervical problem. Do not go into for a very long time into conservative online therapies just because you think that you are not putting in enough effort and that is what is causing the spine pain. If there is a constant continuous spine pain that is not resolving with the usual methods, it definitely needs investigation. It is more common than one might think. And the second thing is the majority of spinal tumors can be taken out. 50% of those tumors are benign, which means that they will not come back. They can be taken out with microscopic and endoscopic techniques, often not possible in other places. And more importantly, it can be the first sign of a growing cancer, which, if detected on time, can be significantly controlled or sometimes even cured. So, with that, I'd like to say thank you for listening, and we're always here to help you for any back and spine pain.